Hey, Bistro fans, it's another Monday night of Jill and Christina here with, actually, let's start over here. We have the wrong banner up. Welcoming Advanced Animal Chiropractic here for another Monday night Chiro chat. So welcome, Dr. Cole.
Thank you.
Yes, thank you for joining us.
Yep.
And tonight, we're going to go from the knees to the hips, right?
You got it.
We're going to talk about hip dysplasia. So that is not, I don't know, is that common in cats?
No.
Okay.
Not really.
I think I've heard of it, but it's like super rare.
Mm-hmm.
And then, so hip dysplasia is something more with dogs, but it does happen, and it can happen at any age. I have had customers come in with very young dogs that have had hip dysplasia all the way up to senior dogs with hip dysplasia. We once had a greyhound mix come into our rescue at 6 months old. Her and her litter mate both had hip dysplasia. So why don't you first just do a quick introduction and tell us a little bit about yourself and Advanced Animal Chiropractic?
Sure. So anyone not familiar with me, I'm Dr. Christina. I'm one of the animal chiropractors in Advanced Animal Chiropractic. It's a team of myself and my husband, Dr. Grant. I started the practice over 6 years ago now. We work exclusively on animals, and all we do is chiropractic care. We work concurrently with a lot of standard veterinary treatments. We work out of about 9 different locations, but the one you can find us at pretty much all the time and very reliably is the Pet Bistro in Madison Heights. We are there every Tuesday, Wednesday, Thursday, and then one Saturday a month. And then, yeah, so that's pretty much our story. That's what we do. And tonight we're going to talk about hip dysplasia.
Yeah. So we are so grateful that you are at our store. And I know a lot of pets can really benefit from animal chiropractic care. Most of my animals have been or have experienced animal chiropractic care. Most of our staff has had their pets in as well. So we know it's a modality that can really, really help. And I've seen such awesome results with hip dysplasia. So why don't you take it away? Let's talk about hip dysplasia. What is it? First of all, what is it?
So hip dysplasia is kind of a fancy term for just an abnormally shaped hip. It basically, rather than having your femur head sit nicely in your hip socket, it is like it's molded in a different way. So there's multiple different grades of hip dysplasia, but kind of like what we talked about last week with the luxating patella, there's different levels of severity. The same can be said for hip dysplasia. So it's kind of like having a wonky shaped hip. It's pretty much always bilateral. So that means in both of the hips, you're going to see it. Very rarely is it just one that's affected. And a lot of people, when it comes to hip dysplasia, they hear that and they're pretty much devastated because it sounds very scary and like something that isn't manageable, but we'll kind of go into how that's not necessarily the case. And like you said earlier, Jill, it kind of ranges in all ages, at least when people figure out that their pet has hip dysplasia. So hip dysplasia, it's theorized that it's kind of one of a couple reasons that it happens. One, the big one, is that it's genetic. Like it's a structural thing. It's not something that an owner can do to prevent it. You're just born with misshapen hips. And that's probably the most common way that people find out about it. However, it can also be a result of trauma. So if your pet, for instance, was hit by a car, or at a young age, or really any age, if your pet had any fractures in a hip, anything that's traumatic to those hip joints, when they're healing, they can heal in an inappropriate fashion. So sometimes that can be the cause as well. People who obviously have an animal that's been hit by a car should monitor their animal's hips regardless, just because that's not going to be like an overnight thing where they suddenly have hip dysplasia. It's going to happen over time as the dog heals. And then the third thing, which I will one day we'll just have to do a whole topic on it, is there's been in the last couple of years, a lot of studies done on early spay and neuter and how that can affect the hip dysplasia thing going on. And I actually have a couple that I just want to cite really quick that's super interesting. So there was a big study done with beagles showing that those that were spayed too early, which is usually considered before a heat cycle, for most dogs, I would say is about 6 months of age is when they probably will have their first heat, but that's also just a generality. Some dogs are later, some dogs are earlier. It really just depends on your animal. And part of the reason that they suspect the fact that those dogs ended up developing hip dysplasia more likely is just because when you're spayed or neutered so early, your growth plates are still open. So they're still growing. They haven't fully closed. So when you're removing all of those hormones that are needed for proper growth too early, those growth plates don't really grow properly, or they don't close properly. So that was one study. Another one involved boxers, and that one focused more on early neutering, and dogs that were neutered too early were 1.5 times more likely to develop hip dysplasia. And then the biggest one that a lot of people are familiar with, if you've ever looked into it, is a golden retriever study that was done that involved over 750 dogs.
Wow.
And they actually had double the chance of developing hip dysplasia in males when they were neutered too early. So
that's really fascinating.
It's crazy. And it's something I think that more and more vets are starting to talk about, because obviously there's always been a spay and neuter debate, but I think it's becoming a little bit more prevalent as of late because we are seeing so many orthopedic issues happening. Now, that being said, there's obviously two sides to every coin. So on the opposite end, they also found in some of those studies, like the golden retriever one, that ones that were neutered very, very late ended up having a higher prevalence for different types of cancers. So usually they have to do with, and when I say late, I'm talking like dogs that have not been neutered for 12 years. Like those dogs are more likely to develop testicular cancer. Same with the females, more likely to develop mammalian cancer. Their mammaries end up having tumors, and those sorts of things. So it's kind of similar to humans in the sense that, men are very likely to develop prostate cancer if they live long enough. It's a very high chance. And it's just because your cells are constantly reproducing. The more your cells reproduce, the more likely you are to develop a cancerous cell. So we can dive into that another day, but I just thought that was a super interesting little factoid that it actually has now been shown in multiple studies. And those are just 3. Those are 3 of the biggest ones. There's a lot more out there that are being done. But that's huge, when you think about it. And when you go into the thought of a lot of folks are rescuing these dogs or adopting these dogs, and a lot of adoption spots won't let you take a pet home until they've been spayed or neutered, which I completely understand because there's a lot of irresponsible folk out there.
Yeah, it's really a double-edged sword.
It is. It's totally a double-edged sword. And it kind of breaks your heart because I know for us, my 6-year-old dog was literally neutered when he was 2 months old. That's very, very young. But it was either that or I didn't get my dog. So, it's kind of one of those things where it would be nice if one day we could kind of find somewhat of a compromise. But again, I digress. So anyways, those are kind of the 3 thoughts behind hip dysplasia and why it happens.
So just to recap, it's typically a
genetic.
Yep.
And it's trauma.
And it's abnormal. It's more or less an abnormal kid.
Yep. So it's basically when you see pictures of hip dysplasia, instead of being like a perfectly fitted ball in a socket joint, it ends up being out here, down here, or just like misshapen like this, right? So it would be like taking a lumpy piece of fruit as opposed to like a perfectly shaped orange. It's very different. So people might not think that that's a big deal, and it really isn't usually in younger animals, but as they age, it can become a lot more of a problem. So when it comes to hip dysplasia, a lot of folks have no idea their pets even have it. So some of the most common signals that you might have a dog with it is limping or lameness, pain, and then I would say a lot of them are actually asymptomatic totally, and you don't find out until you just randomly get x-rays done. So for instance, a lot of people in the show circuit or that have agility dogs or any kind of dog that does a lot of activity, they might be getting their dogs x-rayed regardless, just to have an idea. Obviously, dogs that are being bred for sure are getting x-rays done, especially in breeds that are prone to it, like your Goldens. Large breed dogs, it's really more common in than anything else. Little guys can get it too. It's just not quite as common.
Right.
And I would say that's 9 times out of 10 how people find out their dogs have hip dysplasia. Is it's kind of like a fluke situation where they went in to go get them checked out and they end up noting it. Now, again, there's a lot of different levels of hip dysplasia. Very minor hip dysplasia is still considered like a passing grade. So you might have a little bit of a wonky shaped hip, but it might not be so bad that they'd be concerned about that dog breeding or something like that, or that it would have any like long-term effects. So I want to say OSHA or OFA, not OSHA. I want to say they have 6 different grades, and it's not quite like Lexington Patella where it's 1, 2, 3, 4, 5. It's like excellent to not so good, is basically the way they term it. And I want to say the top 3 are like excellent, good, and fair are all kind of passing grades. Like those dogs are ones that, yeah, you should definitely supplement them and keep them at a good weight and all that sort of thing. But it's not like a dire need that you really need to go get this checked out because this could be a long-term issue, as opposed to those that have, obviously severe, moderate, or even mild hip dysplasia. Those ones are usually a big concern, just because most of the time these x-rays are being done on like 2-year-old dogs, right? So they still have quite a bit of life ahead of them. And when you already have a heavily arthritic hip joint or just like a misshapen hip joint, you kind of have to realize what you're in for. So
sure,
I would say that most of the time the way people look at like severe hip dysplasia, which I should have gotten some x-rays ready for you guys, but it kind of varies. Severe hip dysplasia is when that ball in your socket joint is literally basically out of joint.
wow.
It can be a combo. It's almost like it's dislocated, right? And actually some of these dogs do dislocate their hips because those ridges in your hip are so shallow. They're not able to hold in there. It's like a Lego. They're not really connecting. It's just kind of slipping and sliding. So that's not abnormal with dogs with severe hip dysplasia. Most of the time, those dogs are actually quite painful because if you think about it, if their hip is kind of moving a significant amount every step, they're fighting to keep it within joint. So, and that's a much higher load than your knee joint when you think about it. Like it's a bigger joint. It takes a lot more of the load of the brunt of just everyday body activity. So when you've got a socket that's not quite right, it has pretty long-term effects on it. So severe, usually with dogs with severe hip dysplasia, the conventional treatment is truthfully a hip replacement, which we don't often think of when we think of dogs and what they could possibly have done.
I feel like it's something more recent too that they've started doing.
Yeah. So there's a couple, there's I think 2 different conventional treatments, and it kind of depends on the age. If you have a very young dog, it's not a total hip replacement. I think they go in and they carve a little bit so that there's potential for those to grow properly or at least manageably. If you're over a certain age, I want to say once your growth plates are closed, those guys, it's pretty much hip replacement, or you just learn to manage the pain. Right. So that's a pretty big diagnosis for a lot of folks because hip replacements are not inexpensive. I mean, you're looking at several $1,000s and lots of rehab. I mean, that's a lifetime going forward. And that's not just one hip. Usually that's both.
Right.
So, that's at least 10 grand. If not more. So
yeah, I agree with you. If I remember right, I had a client who had double hip replacement, and it was a genetic issue with her dog, and it was upwards of that, and that was just a year and a half ago. So
yeah,
you're right on par.
It's pretty up there, and I think the majority of folks who end up going that route do end up having like pet insurance or something, because if you're getting a dog from a breeder that has been certified good hips and you plan to do a lot of things with them, it's not a bad idea to buy into something like that because they're pretty good about covering it. I always feel bad for the folks that are considering pet insurance and then they just are the unlucky ones that end up getting x-rays before getting the pet insurance and find that out. So needless to say, it's not a fun thing to go down. With your less severe. So your moderate to milds are still uncomfortable, and those are probably, in my opinion, the ones that are going to show up with the limping and the occasional pain. It's not going to be a constant, every step is painful for those dogs most of the time. And it'll be more of, my dog, every time they play, they come up limping for a little bit. Or when we go on a walk, we get home and for an hour, they're limping, especially in a young dog, that's definitely not normal. And if everything else checks out, that's usually where my mind goes next, is that, okay, something is off with these hips. That just doesn't make sense that, a 16-month to a 5-year-old dog is lame every time they're done playing. That's not a normal thing. And you shouldn't ever think that that's normal. So if you do see that, you definitely want to go get it checked out. And truly, diagnosis is through x-ray, right? So it's an easy diagnosis. It's not like you have to go through this rigmarole of all these different tests. You'll see it right on x-ray. So you'll know pretty quickly if that's what you're dealing with. The nice thing is with hip dysplasia is that if it's not super, super severe, and even severe cases can benefit from chiropractic just because it can help ease discomfort and manage it a little bit. But with the rest of them, it's super manageable. Like, these are things that the goal is, hip dysplasia isn't a curable thing. Like, that is a structural malformation. It's not going to go away unless you're doing a surgical route, right? So if you're just looking at trying to manage the condition and make your pet as comfortable as possible, there's a lot of treatments you can do to help do that. And I guess one of the biggest concerns with hip dysplasia is the things that could happen because of it. So while that won't go away, what you need to be concerned about is the knee injuries that we've talked about a couple times. The cruciate injuries, you're way more likely to have a CCL injury if you have hip dysplasia because you're constantly compensating back there. Another thing that's super common is because you have hip dysplasia, you're going to have a pretty arthritic animal a little bit earlier in life compared to one with healthy hips. Their body's natural reaction is going to be to form more bone to try to compensate for that abnormally shaped joint. So all that being said, there's a lot of things you can do to manage it. Managing hip dysplasia is not something that is way out of reach for you. The biggest thing that most vets will stress is making sure you have a good weight on your pet. You cannot have an obese pet with hip dysplasia. That is just, and really you can't have it with anything. But if you've got a dog with hip dysplasia, that dog needs to be fit and trim as much as you can, because as they age, it will get worse. You'll be more arthritic. So if you have a heavy animal, it's going to be so much more difficult for them to function when they have hip dysplasia and heavy arthritis, as opposed to a fit and trim one. It's a lot less weight for those hips to carry. So it's a lot easier to manage when you have a good weighted dog, a strong dog. Exercise is usually the second most important thing when it comes to it. You want a dog that's active, even if that's only a couple, quarter of a mile walk a couple of times a day as they age. Movement is so important. The more they move, the less pain they feel, and it helps dissipate inflammation. So if your dog is just sedentary all the time and they're not moving and they're couch potatoes, it just allows for inflammation buildup in those joints, which again causes more arthritis. So exercise is super important. There are a ton of exercises similar to the ones that we've recommended for the knee that you can do to build up the musculature around those hip joints, so that when they kind of need to cheat because they might be a little bit in pain in their hips, the muscles can kind of act up and say, okay, we're here to help, like that's with any walk in life. If you've got a strong dog, those muscles really help when your pet needs to compensate and when they need to cheat a little bit from their normal structure. So I would say you've got good weight, you've got to exercise. Swimming is one of the best exercises for hip dysplasia. It's weightless. They can, any age, hydrotherapy is great. It's really, really helpful. And doing your exercises leads to strong muscles. So also super important. Obviously chiropractic, it's awesome at helping with everything. So when you've got a dog whose hips aren't working right, everything else needs to help. Everyone all needs to pitch in order for that dog to function. So low back, knees, ankles, all of that comes together to help for this one weakened structure, right? And what we can do is to at least help alleviate some pain, keep them comfortable, keep them moving so that while they are compensating, it's not getting to a point where you're so locked up elsewhere that you then have insult to injury. So chiropractic can help a lot with that. Another big thing is acupuncture. Acupuncture is awesome. It helps make sure energy flow is good throughout the body. When you have physical structure that is improperly formed, you're bound to get some stagnant energy flow going through there. So acupuncture can be really helpful, especially when you have a painful dog. Cold laser is awesome. It's so good at managing inflammation. It doesn't hurt your pet at all. And half the time they don't even know what's going on. They can just fall asleep. It's amazing. It helps stimulate healing. It helps stimulate, the cells, everything like that. So it's huge. It's a great, great avenue to go down when you've got a dog with hip dysplasia. And then another thing you guys can always look into is, we're big proponents of ice, but when it comes to a chronic condition like this, the heat will really help. And usually a moist heat is kind of what we prefer you to do, because if you just do straight up heat, it will start to dehydrate. But if you use like a moist heat, you can even get, there's all those bags that are like little sand bags or whatever they have in them that you can heat up for them and lay. I couldn't even tell you what they're like little BBs in there, but those are almost more of a moist heat. As opposed to just like a heating pad. They make special beds. You can do any of those sorts of things, but heat will really help with the muscular portion of it, because they're bound to get tired. They're bound to get achy. They're bound to get sore. So those things can be really, really helpful. Obviously, if you go for a W, I can't say the actual words since I've got dogs in my own home, but if you go for an actual W and your pet is acutely limping after you go, that's a time where I'd want you to use ice. Ice is going to help with the initial acute inflammation. Chronic conditions like arthritis and those sorts of things will benefit from the heat because it just is soothing. So you kind of have to use your logic and your common sense. If your pet is just limping 24/7, that's going to be more of a heat situation. But if this is just like, oh, we just played and now my dog's limping, that's an ice situation. So both really helpful when it comes to hip dysplasia. Now, last thing I know we want to talk about was supplements that are really, really good for hip dysplasia. So kind of like what we talked about last time, especially if you find out when they're young, those are dogs that are going to be on supplements their whole life. Just accept it. It's much cheaper than a hip replacement. And it's also really, really effective. You can help your dog feel really good, and you can help prevent degeneration of those hips even further. So again, I love my collagen. Collagen's awesome. It helps with rebuilding. It helps with maintaining. It helps with elasticity. And especially in an animal that's going to be stiff in those hips, really, really helpful. With these guys, I definitely recommend looking into like a natural pain reliever. So obviously the CBD is awesome. If your pet doesn't react well to that, there's tons of other options. Turmeric, one of our favorites, it's really, really good as far as a natural anti-inflammatory, and there's no problem with using that throughout a lifetime. If you're not lazy, you can make it yourself. There's great recipes for golden paste, but if you're like me and you hate what it does to your kitchen and your spoons and your pots and pans, because turmeric is very potent as far as staining things, I would just purchase some pre-made stuff for you. If your pet is averse to the taste, because sometimes that's a potent taste and they might not care for it, fish oil is always awesome. It's a great natural anti-inflammatory. We can talk about it again as far as diet goes. These dogs should be on the least inflammatory diet that you can possibly find, because otherwise you're just going to have a constant state of inflammation in their body, which they're already in a constant state of inflammation. So to add insult to injury by giving them food that basically promotes inflammation is just not a good idea. So whether that be a cooling kibble, because that's kind of where you're at, or if you're willing to go the raw route, which is, I'm a huge proponent of that. I think that I have incredibly healthy dogs. This one, as you can see, because of it. We really aren't frequent visitors to the vet because we don't have emergencies. We don't have these issues. They've got great skin. They've got healthy joints. And I attribute 99.9% of that to their supplement regimen and their food. I don't have to add a lot of stuff to their everyday routine because they're on a raw diet. So they're getting a lot of what they need, so that's huge too. But you can get a diet that's catered to your pet. You guys offer those services, which I think are amazing, because you can speak to someone and really talk to them and figure out what is going to work for their lifestyle, what's going to work for their pet. I mean, I know you used to do them, Jill, but I know you're super busy. I think Delila's been doing them recently.
Yeah, or maybe we have a couple staff members. Dalila and Jennifer are both doing nutrition consults now. So yeah, they're pretty affordable. So it's 30 minutes or $39. It's $39 fee for the consult, but it really helps us be able to have some one-on-one time because we can then ask clarifying questions specific to your pet. Yeah. So we can make suggestions based on your pet's needs rather than kind of a blanket statement. Totally. So if there's already allergies, or if there's proteins that we need to avoid, or if we know that there's hip dysplasia, we already know there's foods that we probably wouldn't suggest because they do have those inflammatory ingredients in them that would be more prone to bringing on more inflammation. Yeah. If you're unsure about raw, or how to make a transition to raw, or how to even add or incorporate raw to what you're already doing, if you want to continue with the dry food, we can help you make those transitions as well as supplement suggestions. So what have you tried? What have you not tried? What out of the things that you've tried, what do you feel like has made a difference or not made a difference? So it really just gives us like focused time, specific to your appointment, because otherwise, if you come in just to chat, what happens most often is that, several more people come in behind and we just don't have the focus of that one-on-one time. So yes, absolutely. We are more than happy to help anybody out if they're looking to make a diet change.
Yeah. And so that's huge. And what I would say is, like I said earlier, is that a lot of these pets are totally asymptomatic. So even though your pet might not be showing signs that they're in pain or that they're lame or anything like that, that is not an excuse to not supplement their diet. Just because it's not happening right now doesn't mean that it's not going to happen in a year, in 2 years, in 3 years. Prevention is always better than trying to play catch up, because you're not going to be able to catch up with hip dysplasia. Hip dysplasia is one of those things that it's not really a joking matter. Like, as soon as you need to take proactive measures so that your dog can be comfortable and live a good quality of life. Otherwise, you're going to have a 5 or 6 year old dog that's acting like they're crippled, like they're old, like they're 15, and that's not a life for them, because while their hips might be bad, the rest of them is a 5 or 6 year old dog. So it's a very difficult decision and difficult thing to deal with when you have a younger animal that's acting like they're 15. So their organs are good, everything internally is good, but their hips aren't. So, that dog's going to have a long life of pain if we don't try to manage it. And there's so much that you can do to do it that it's not something that should be daunting. It's a manageable condition. So it's just one of those things that a lot of times we have folks ask us, like, well, what can you do for what's going on? Again, chiropractic can be really helpful. It's all about structure. We can't fix that hip joint. We'll never be able to fix that hip joint, but we can make sure the knees, the low back, the actual hip joints are doing okay, moving as well as they possibly can, so that you don't have a young pup with severe arthritis or anything like that. So yeah, it's manageable. It's way more common than people realize. And especially if you're getting a medium to large breed dog, that's something that you should definitely look for, or just watch out for. So if you see the consistent limping and it's not just one leg, or if it swaps and you've gotten them checked out and it's not their knees, that would definitely be my next thought, is that I would look into something like that.
Sure. Yeah. And I completely agree with you. So my own experience that I was referencing, the Greyhound, Wolfhound that we had come into the rescue, she was 6 months old, and she had a sibling that also came into our rescue that was 6 months old. I took Kipper in as a foster, and then the other dog went to a different foster home. And it was interesting because at the time I had fed a raw diet, and I had given her the advanced mobility from Oma's Pride. And the other home actually did a dry food and did like a conventional over-the-counter glucosamine chondroitin. And they were having tons of issues still with their dog being very painful and having a hard time, where my dog was out digging 6-foot holes in my backyard and having a blast. So it was very interesting. Like, you can definitely see when you put the right fuel in the body and the right supplements that it can really manage the symptoms pretty dramatically.
Yeah, absolutely.
Yeah. So there's a couple comments here. I'm going to run through them. They kind of correlate to a couple of my questions that we have as well. So somebody had posted, how do you know if your dog or puppy have it? And I think we kind of covered that diagnostically. It's through an x-ray. Unless obviously there's, like you said, some of the symptoms, limping, painfulness, injury, lameness or limping after playing, things of that nature. I think that kind of covers that question. I'm so glad you mentioned swimming. That was something I was going to ask, like, what is one of the best exercises? And I think swimming is fantastic, especially now. Everyone has pools and they can go out in lakes and do those things to get out and be part of the family and enjoy being part of the family, but also doing an exercise that's easy.
Totally.
Somebody had asked, I think we kind of covered this as well, just kind of a recap. How do cats and dogs get it? Genetics, deformities, age, sometimes it's breed disposition. Yeah. So there's all sorts of different ways that dogs can get it. But kind of going along with that, it's not a like ending sentence. It's manageable, thank goodness, which can help prolong your dog's life. And it's not like this is it. So that's fantastic. Dr. Ashley Rich just says hi with a heart. Dr. Rich actually is a human chiropractor, so she practices out of Berkeley. So I'm so glad you're here, Ashley, joining us. Nice of you to meet Dr. Cole. My other question for supplements, any age? I know, so we have some supplements that help with like young dogs that are younger. So they might not have the anti-inflammatories in them. It's more your glucosamine, chondroitin, and hyaluronic acid. But if you have a large breed dog, do you have a recommended age for a dog to start using supplements?
Honestly, I would say straight out the gate. I mean, you've got those dogs develop like a teeter-totter. Their back end grows, their front end grows. There's so many other things that are involved, and puppies are so clumsy. So add into the mix that they're like on this weird growth spurt where they go from 15 pounds to 30 in 2 weeks. I mean, you've got like this clumsy prepubescent little kid and they just don't know what to do with their body parts. So it's always a good idea to start as soon as you get them. I mean, it'll be a lower dosage because it's a lower weight and that sort of thing. But I think it's just as important to have like a natural anti-inflammatory in their bodies, especially like a fish oil from the get-go, just because they're going to be getting inflamed from growth. I mean, growing pains is huge, but because they're wonky, they just play hard and they play weird and they don't really have body awareness yet. So they trip over themselves and all those things can add up. So it never hurts. There's really not a too early mark for supplements like that.
Good. And I totally agree with you. So like I said, we do have supplements that start for young dogs all the way obviously through our senior dogs. And it is more common. Like you said, I've seen it in small breed dogs very rarely, but it is more common. Your Great Danes, your German Shepherds, your Golden Retrievers,
your Labs,
some of even your like
boxers,
mixed breeds too. And if they're a combination of all of those breeds, they can show early signs of hip dysplasia.
Yeah.
And if you have a couple x-rays, I would love to add them to our comment section as well. So if you have,
I'll try to find some for you.
That might be kind of fun. Oh, looks like we have a couple more comments and questions that came up. So Cate is asking, with chiropractic care, do you start with just doing massages before you do any kind of adjustments?
Nope, we strictly do adjustments. So while you can totally massage your pet at home to really make sure the musculature is staying nice and loose and not getting too spasmed, that's something that you guys can do and really keep your pets feeling good and make sure we're not getting too inflamed or too spastic in any one specific region. But we do just chiropractic care. So they get adjusted on their first visit.
Perfect. And then we had another question. Is there anything that makes it worse once they have it?
I mean, that's really going to be a case dependent question. So if you have a dog that's got severe hip dysplasia, I mean, excessive exercise or hard exercise like zoomies and hard play in a yard with uneven surfaces is not going to be an ideal situation for them. Dogs that are asymptomatic or just occasionally come up lame, you can pretty much live a totally normal life with that. It's really going to be the ones that are severe that you might have to alter your lifestyle a little bit for them.
Okay. And then also maybe along those lines, like once a dog has been diagnosed and they've made the decision to start chiropractic care, how often would you need to see a dog that has hip dysplasia?
So it'll really come down to how severe the hip dysplasia is and how symptomatic the pet is. So if you've got even an asymptomatic dog that has diagnosed hip dysplasia, that's not one that we're going to be needing to see super often, as opposed to one that might be currently limping or dealing with other issues like low back pain or something like that. Those guys we'd probably want to see a little bit more often to start until they get to a point with being comfortable and not having that lameness quite as often. So we do work on a couple different boxers that have significant hip dysplasia. And I would say maybe their first 2-3 visits, we probably saw them all within a month. So I would say maybe 2-3 times in a month. And now once they're pretty much stable, they tend to come in if they have a really heavy play date, even if they're not limping afterwards, just because they know how difficult that can be on their bodies. So you kind of have to be your pet's advocate in that sense that, sure, you know, if you have a heavy play date or you guys have a heavy week of being camping or something like that, where there's a lot of activity that wouldn't really be in their normal life, then that would be something where I'd probably tell you you'd want to get your pet in sooner than later. Otherwise, if you get them to a point where they're pretty stable, it's pretty easy to just maintain them on like maybe a bi-monthly or something like that basis. So it really is going to depend on the size of the dog, the activity, and the age to kind of determine a recommended like care plan. But sure, everyone's a little bit different.
Of course. Of course. Cate just asked, how do you deal with phobic dogs with their first few treatments?
So if she's just referencing dogs that are nervous, we see a lot of that. That's not something that I'm not unfamiliar with at all. We always want to make sure that your pet has the best experience as possible. So, I mean, Jill can attest to this. We've had dogs that have, you know, even just come, we try to schedule ones that are phobic either at the very beginning or the very end of a work period so that we can give them a little bit more time to just kind of be used to our space and our person. That being said, with a dog that's a little bit nervous, I would never push them past their comfort zone. So I know we've had a couple different dogs that we've worked with where maybe the first visit or two, they really only got maybe 2 or 3 segments adjusted just because you want them to end on a positive note and never really feel, you know, nervous or anything like that. So it's really about letting them get comfortable with us. We obviously are packing with cookies, so that's helpful. And, you know, we work on the ground. So we're always there on their level. We do what we can to help them out. And obviously there's myself and my husband. So if you have an animal that's good with women, good with men, like we have options for all of that.
Right. So Cate just quickly mentioned she's diagnosed neophobic. I guess, Cate, if you wouldn't mind elaborating on that a little bit more. I'm not quite sure what that is or what.
New person phobic? Like maybe nervous about?
And sometimes too, like a meet and greet might be a possibility as well. We can schedule a meet and greet and see how your dog does in the space. Yeah. If it's the closed room that is the issue, we have several different options. We can adjust outside. Yeah, that's what she said. Anything new. That's
not normal. We've definitely seen that before. So I would say in that kind of situation, it would probably be easier to work outdoors where there's no confinement. There's other things going on. So if she or he needs a break, they can have a break and, you know, move on, like that sort of thing. So it's hard for me to tell you over this because I don't know your pet. So it's a little bit difficult to kind of give you a general guideline for it. But I will say we work with a lot of dogs that are very scared and they actually do pretty dang well. So I don't think I've ever, maybe 1 or 2 pets that I haven't been able to work on because they're so terrified. But that's, again, in 6.5 years of practice, to only have 1 or 2 pets that really couldn't accept and be worked on, that's pretty good odds.
And Cate, you're always welcome to bring your pup to the store and let them walk around and check out our store and get used to our store environment and smells. So I don't know if your pup is open to that, like coming in a couple times, or even just putting them in the car and driving them up to our building. Next time you pick up food or treats, you're always welcome to do that. And sometimes, if she's done that repetition maybe a couple times, maybe that would help. So you are always welcome to bring your pup into the store and prior to an appointment to see if that helps. So our next question here leads us right into our next segment, which is she is asking, or he, how much do we, this is one of our Facebook fans, how much do we pay for it and how many times do you do it when you buy it? So let's move into chiropractic appointments, because I think that will answer those questions. So why don't you tell us about your chiropractic services, both the difference between an initial appointment and a follow-up appointment?
Sure. So our initial appointment lasts a little bit longer. It's anywhere from like 20 to 30 minutes. That runs $90. It's a full palpatory exam. We do a gait analysis. We do a full history. Anything that's pertinent to what we are dealing with your pet. We send you a whole report so you can see everything that gets done. We often give you guys exercises, sometimes not on the first visit because that can be a little bit overwhelming. But so that's about 20 to 30 minutes. Our follow-ups are roughly 10 to 15. Those run $55. It's the exact same thing as the first one, except we just don't need to take a long history. And at both of them, your pet will definitely be given copious amounts of cookies.
Copious amounts of good cookies.
Good cookies. Good cookies.
Perfect. And I also wanted to mention that I know you had made mention of a laser treatment, cold laser. So if anybody is interested or you are unable to go to your veterinary clinic to actually have cold laser done, we do have a rental laser at our store that you can rent by the week per 7 days. So if anybody's interested, you're more than welcome to reach out to us at the store. Our number is here, 248-548-3448. We can answer any questions. Dr. Cole and Dr. Tully both have their schedule put up on our website, or you're welcome to call the store to book an appointment. We are more than happy to help you if you have questions. Like I said, myself and most of our staff members have had our pets adjusted. We've seen many, many, many pets get adjusted, and we've seen the results, and sometimes they're amazing transformations, so it can be super beneficial. Let's just make sure we don't have any other. Oh, Rachel just says no questions. Just want to say that they highly recommend Dr. Christina. Thank you for your testimonial, Rachel. We really appreciate that. And Kate's asking about the cold laser rental. Cate, if you give us a call tomorrow, we would be happy to discuss that with you. So here's our number, 248-548-3448. And we can chat about the laser rental as well. Anything else you think we missed tonight, Dr. Cole?
I don't think so. I think we got into it.
Yeah, I think we got a lot done. So if anyone has suggestions for topics, please leave it in the comments. We'd be more than happy to take on some suggestions. Dr. Cole and I are just kind of rolling through the body. And I know everything kind of happens in phases, like we'll see a lot of one thing. So it might be just something that we pick a topic and talk about. Cate is saying that was great. Thank you so much. Absolutely. I'm so glad you could join us and we can get your questions answered for you. But like I said, Dr. Cole and Dr. Tully are at the store weekly, and any one of us would be able to help. Let's see here. Oh, Jennifer just snuck in there. I would have never known Roxy was out of whack until without Dr. Christina. Awesome testimonial. Again, sometimes you get a young dog and Roxy acts all crazy and excited, and she's young, so you probably wouldn't know it unless a trauma happened or an event happened that would call for chiropractic care. So any age animal can definitely
benefit.
benefit and use chiropractic care. So awesome. So I'm so glad you were able to join us. We'll be back again next Monday, 7:30 with a new topic, and we'll see you guys all then.